Thank you for the opportunity to share our work. I'll be speaking to you today on behalf of the Massachusetts Emergency Medical Services for Children Committee. Today, I'll discuss our statewide collaboration to deliver and evaluate simulation-based curriculum for EMS providers. We know that of the 30 million patients transported by EMS annually in the United States, children represent only 7% of EMS activations. Critically ill pediatric patients are low-frequency, high-stakes events. Previously identified barriers to quality pre-hospital pediatric care include limited initial pediatric training, infrequent exposure to and provider discomfort with pediatric cases, and challenges accessing pediatric continuing education. Therefore, we created a multi-center collaboration between academic emergency departments through EMSC sponsorship. Each EMS region in the state was paired with a pediatric emergency department. We developed and delivered a simulation-based pediatric curriculum and administered 5 8-hour training days over 6 months. We performed a prospective, interventional, single-arm educational study with a pre-post assessment designed to evaluate the impact of the curriculum on pre-hospital provider knowledge and confidence. For our results, 188 participants from 97 towns and agencies completed the pre- and post-assessment. 58% were ALS providers, 69% were male, 32% had between 2 and 5 years of experience with EMS, and 33% had more than 15 years experience in EMS. 34% were from a fire-based agency. Our mean pediatric knowledge scores increased by 9.8%, with the 95% confidence interval shown here. 93% of participants reported increased confidence in caring for pediatric patients. More than half of those who completed follow-up surveys reported using skills acquired during the training and clinical practice in the subsequent 6 months. The map included shows the 5 EMS regions of Massachusetts outlined in blue. The red dots represent the towns from which the participants came. The blue crosses are the hospitals that participated in the training, and the green stars are the training day locations. On the far side, the box plot represents the assessment of pre-training, post-training, and follow-up intervals. The lines are the median pediatric knowledge assessment scores. The boxes include the 25th and 75th percentile, and the whiskers are the upper and lower adjacent values. These box plots show improved and sustained improvement in pediatric knowledge scores. In conclusion, by utilizing EMSC partnerships to foster a statewide collaboration, we delivered a targeted simulation-based pediatric curriculum for pre-hospital providers throughout the state. Participants demonstrated improvement in knowledge and confidence caring for pediatric patients. Follow-up data suggests knowledge and skills obtained as part of the curriculum were able to be translated into practice. Thank you again for the opportunity to share our work. My contact information is included in the poster, and I'd be happy to discuss with anybody who's considering similar projects in your local regions. Thanks again.